So this is actually a very interesting topic that I wanted to talk to you about. Is like what will happen with the white coat in the post-COVID-19 era. So we all know that a white coat is the symbol of excellence, or a symbol of our profession in medicine. And in fact, every medical student, when they get into med school, there's what they call the white coat ceremony, where they're provided with their first white coat. Now, is this important for patients' perception? So this was studied actually in 2017, and 53% of the 4,000 plus patients studied in a hospital setting, they said that the way or the attire that the doctors wear was important. And about a third of those said that the attire influenced their satisfaction in the treatment that they received. The attire that was, this was in a hospital setting in 10 hospitals in the US, the attire that was seen as the most, or perceived as a better in the primary care setting, a hospital setting, was a formal attire with a white coat, meaning a button-down shirt, a tie, and a white coat. And in a surgical setting, scrubs, or in an ED or emergency setting, scrubs. Now, there's been a lot of concerns in terms of white coats being not as hygiene or a propagation of bacteria and viruses, and I think this will play a big role in this era. So some of the concerns that were backed up by studies, there was a study where they evaluated the ties of a lot of orthopedic surgeons, and the bacteria in the tie actually was exactly the same as their patient's bacteria in the wounds. Also, they studied how often the doctors wash their white coats. This was very interesting, about once a week. So why are they a source of propagating disease? Well, they're not washed as often, and also they're kind of in the middle of preventing the routine wash of your hands, and also touching every single surface that you interact with. So in an era now where hygiene and the frequent washing of your hands, it's going to be more and more important, and patients are going to be more aware, then I feel the white coat may have another role in our profession. So in conclusion, first, I think this study in 2017 is going to have to be repeated, including now what patients' perception is in regarding of hygiene. And also, I think we're going to see an increase in the use of scrubs in even clinical settings or non-surgical settings. And actually, that is going to be started to be perceived by patients as a good thing, because it will allow us to increase our hygiene and just decrease the propagation of bacteria and viruses. So we will see what happens, but I think this was something interesting that I wanted to share with you all.